quick summary of what epilepsy is. As I mentioned, it's usually a electrical thunderstorm, proper thunderstorm that's going on in your brain. And it's like a massive cloudburst with electricity that just pummels the brain for a few seconds. And it goes on for a period of time. And one thing that I want to make very, very clear about how to manage a patient who's having epilepsy, make the space that they're in safe. So if there's electrical cables, or if there's water, or if there's any hazard, move the person out of that hazardous space. That's very important. The second thing to mention is protect their head. So if you've got no pillows hanging around, fold your legs, sit down next to the person, put the head into the lap of your legs, and protect that head from banging itself on the floor. The person stops having a seizure because during that seizure episode, they stop breathing. And while they stop breathing, there's a lot of saliva that is being built up in their mouth. As soon as the seizure activity starts waning, flip them onto their side. And the reason for that is that all that saliva goes into the cheeks of their mouth. And as they take that first breath, that's what basically stops the seizure, is that your brain CO2 levels go up. It stops the seizure activity that's in the brain. And at that moment in time, you take that first breath. And as you take that first breath, if your mouth is full of saliva, that saliva goes into your lungs, which we don't want, because then you're going to get a pneumonia. So we don't want you to get that. So those are the practical office side things to do in any workspace. The second thing to do is, most importantly, understand that that person's then going to be quite drowsy, quite confused. They're not going to be irrational in that they're going to start doing strange things. Let them lie there until they wake up by themselves. Once they've woken up, take them to a place of safety, usually to a healthcare facility. If they feel that they're not in need of the healthcare facility, try to convince them to get to the healthcare facility. Put them into bed and let them rest it off. In the workspace, I think the most important mention that I have to make is that if it's possible, I know it's not always possible, in a small little micro business environment where there's 3 or 4 employees, they may not be able to accommodate the person. But if they can, make an effort to accommodate that person, to most importantly get access to their medicines, go to their clinic visits so that they can get a hold of their medication. Make sure that they're in a safe space. If you're working at heights, make them rather do some other work, but that doesn't endanger their lives and and most importantly the other employees as well. And last and most importantly, it is a disability and we must accommodate and make sure that we educate everybody, and especially the employer, about the fact that they can be adequately affiliated with every other job that they need to do, and that we want to bring them back to a normal space. And that is the goal of every epileptic patient, to be able to reintegrate into society and into their families and into the workplace, and it can be achieved. Thank you.